Welcome to The Explainer. We're diving into a condition that affects a huge number of women, but for the longest time, its diagnosis was a total mess of confusing, outdated terms. Today, we're breaking down abnormal uterine bleeding and the brilliant system that finally brought some much-needed clarity to the chaos. Coein. And when I say a huge number, I mean it. This is not some rare issue. We're talking at least 1/3 of women worldwide will deal with abnormal uterine bleeding or AUB at some point. That sheer scale is exactly why having a clear, systematic way to think about it is so incredibly important. So, what exactly is AUB? Well, the International Federation of Gynecology and Obstetrics, we'll just call them FIGO, defines it as basically any symptomatic change from a normal menstrual cycle. And the key word there is any. This isn't just about heavy bleeding. It's about changes in frequency, regularity, how long it lasts, or the volume. It's the whole pattern. One of the biggest leaps forward was simply getting everyone to speak the same language. For years, medicine was bogged down by these imprecise terms like menorrhagia or this super vague catch-all dysfunctional uterine bleeding. The new FIGO terms, they ditch all that ambiguity. Now we have clear, descriptive language that actually means something. And this wasn't just some academic debate about words. When you don't have a common language, figuring out the root cause is a nightmare. It held back research, it made it harder to develop targeted treatments, and it was confusing for patients. This is the exact problem that the Coein system was designed to solve. All right, so here's our game plan. First, we're going to introduce the whole Coein system. Then, we'll dive deep into each half. First, the Palm group, which are the structural causes, and then the Coein group for the non-structural ones. And finally, we'll tie it all together to see how this system completely changes patient care. So let's start with the framework itself, the system that brings order to the chaos of diagnosing AUB. And this image right here illustrates the core concept beautifully. Coein is just a simple, elegant mnemonic that splits all the possible causes of AUB into two main buckets, structural and non-structural.
So here's an easy way to think about it. The Palm group is all about the hardware, physical, structural problems with the uterus. These are things you can literally see on an ultrasound or identify under a microscope. The Coein group, on the other hand, is the software, functional issues, often related to hormones or other body systems that you can't just spot on an image.
Okay, let's kick off our deep dive with the Palm group. And for each of these, we're not just going to name it, we're going to get into the nitty-gritty of the pathogenesis, the actual mechanism of how it causes the bleeding. First up, P is for polyps. These are basically benign overgrowths of the uterine lining. Now, a lot of them are actually asymptomatic, but when they do cause bleeding, the pathogenesis is thought to be pretty mechanical. They create an irregular surface, and they often have these fragile blood vessels that are just prone to breaking and bleeding, which can lead to spotting or heavier flow. Next, A is for adenomyosis. This is a fascinating one. It's when the endometrial tissue, the stuff that's supposed to line the inside of the uterus, actually grows into the myometrium, the muscular wall. The reason this leads to bleeding is a triple whammy. This misplaced tissue causes the uterus to get bigger, it promotes the growth of extra blood vessels, and it seriously messes with the coordinated muscle contractions that are supposed to clamp down and stop bleeding during a period. Then we have L for leiomyoma, which you probably know as fibroids. And these are incredibly common. They don't just have one way of causing bleeding. They kind of attack from multiple angles. They can increase the surface area of the endometrium, meaning there's more to bleed. They can develop their own fragile, abnormal blood vessels. They can interfere with the local clotting factors right there in the lining. And they can physically distort the uterine cavity, which stops it from contracting properly. And this chart really puts that into perspective. A 2024 study looked at 150 women with AUB and, well, you can see for yourself, leiomyomas, fibroids, were the #1 structural cause by a long shot, accounting for nearly a quarter of all cases. And rounding out the PALM group is M for malignancy and hyperplasia. Now, this is less common, but it's the one you absolutely cannot miss. The pathogenesis here is all about abnormal growth. These tissues create their own new, disorganized, and very fragile blood vessels, a process called neoangiogenesis. These vessels rupture easily, and the tissue itself can break down and ulcerate, leading to persistent, irregular bleeding. Okay, that covers the structural or the hardware issues in Palm. Now let's switch gears and look at the software, the Coein group. We're moving away from things you can see on an ultrasound and into the world of hormones, blood clotting, and systemic function. C is for coagulopathy. This is about systemic bleeding disorders. So the problem isn't in the uterus itself, it's in the body's entire clotting system. Think about it. During menstruation, you need a stable blood clot to stop the flow. But in women with conditions like von Willebrand disease, that process is impaired. The clot doesn't form properly, and you end up with heavy, prolonged bleeding.
Now pay attention to this one. O is for ovulatory dysfunction, and it is the single most common cause of AUB overall. The pathophysiology here is purely hormonal. Normally, after ovulation, you produce progesterone, which stabilizes the uterine lining. If you don't ovulate, you don't get that progesterone. Instead, you get continuous, unopposed estrogen stimulation. The lining just keeps building and building until it becomes unstable, outgrows its blood supply, and then sheds in this really unpredictable, chaotic, and often very heavy way.
Next is E for endometrial. This one is a diagnosis of exclusion. So imagine a patient has regular ovulatory cycles, and we've ruled everything else out. The problem must be intrinsic to the endometrium itself. The theory is that there's a local imbalance in the molecules that control bleeding, maybe abnormal production of prostaglandins, which affect blood vessels, or maybe the local system that breaks down clots is just a little too aggressive. I is for iatrogenic. This is a fancy way of saying the bleeding is caused by a medical treatment. The mechanisms are pretty diverse. Hormonal contraceptives, for instance, can sometimes cause endometrial instability, leading to breakthrough bleeding. An IUD might trigger a local inflammatory response. And it's pretty obvious how anticoagulant drugs would do it. They're designed to impair clotting everywhere, including in the uterus. And finally, we have N for not otherwise classified. This is basically the essential catch-all drawer. It's for rare conditions that don't neatly fit into any of the other boxes. Things like a chronic infection of the lining, abnormal connections between arteries and veins, or issues related to a C-section scar defect. So, we've broken down all the causes. We've got our neat little boxes. But what does this actually mean for a patient? Let's look at how this elegant system creates a clear roadmap for diagnosis and treatment. See, the real power here is that it gives clinicians a logical pathway. You start with a good history, and right away, clues might point you towards a category. If a patient mentions easy bruising, you're already thinking AUBC or coagulopathy, and that guides your next move, what lab tests to order, whether you need an ultrasound to look for palm causes. It makes the whole process so much more focused and efficient. And this quote just nails it. Palm Coein isn't just a list to memorize, it's a foundation for care. It helps clinicians think methodically, moving from a broad symptom, abnormal bleeding, to a specific diagnosis, like AUBL for a fibroid. And once you have that specific diagnosis, you can offer a specific, targeted treatment. So in the end, by creating this universal language and logical structure, Palm Coein does so much more than just tidy up some definitions. It standardizes care across the globe. It makes clinical research way more precise. And most importantly, it gets patients to a faster diagnosis and a more effective, personalized treatment plan. And that is how a simple classification system can genuinely improve the quality of life for millions.